Welcome to the Easy Baby Academy, your online source for expert pre- and postnatal education. Check out our courses at easybaby.co.za by clicking the link below.
Hello and welcome. Today we are incredibly lucky. We get to sit down with occupational therapist Jen Kirk. She's going to be talking us through milestones and development in babies. Thanks for joining us, Jen.
Thank you, pleasure.
I would like to start off just finding out from you in a real basic way, what are milestones? What are these things that we're looking out for in our developing children?
So Mike, basically milestones are a pattern at which a child develops certain motor skills. So basically what we're looking for is that at a certain age a child has developed the required motor abilities to elicit some motor action. It's really important that a child achieves each motor milestone within a range that we do expect, because the fundamentals of what they're actually developing are shown throughout that greater milestone.
And are there times where it's more beneficial to develop a certain milestone? Do they run in?
Absolutely. So the way it works is that a milestone, there are some milestones that are more important than others, but generally your infant developmental milestones are the most crucial ones. Those are the milestones that almost set the foundations for development. So what we're looking at is really postural, gross motor milestones in the infant ages, and once we've got all of those up until about 12, 14 months of age, those are really the most crucial times, and then development after that is really successful.
Okay, all right. Now, to move on to get these milestones, a lot of people talk about moving on from primitive reflexes. It's become a bit of a buzzword. People like to talk about it.
Yes.
Just lead us through, what is a primitive reflex?
So basically a primitive reflex is these things that arrive, they're present for a certain period of time and then they disappear at a certain age. And basically what they are is they show the integration and the maturation of the central nervous system. So basically what happens is a certain reflex will arrive at a certain time. Sometimes a child's born with them already, and sometimes they come a little bit later on in development, and they assist a child in developing a certain pattern. Once that pattern is developed, and once we can see that the reflex has been integrated, then we know that the central nervous system has started to integrate and started to mature, and they've achieved whatever they needed to achieve, particularly from a postural perspective, is what we look at as OTs.
Okay, so like you would weigh a child, and like you would measure the height of a child, these outcomes are another measurement, but we're measuring the way that they're developing.
Absolutely. So they're really, really important. A lot of people look at them as a bit of a tick box, which exactly is what it is are the children developing at the right time, at the right speed?
Okay.
And it's not just generally that are they achieving what they're needing to be achieving, but we look at so much more about achieving a milestone. So it's not as to say, oh, are they crawling? Yes, they're crawling. It's how are they crawling? Have they been crawling for the extended period of time that they're needing to be crawling? And what's the quality of the crawl? Because those types of things are really important.
Okay, and that's really interesting, because I think a lot of people will approach it like that. They'll go, my child has rolled, and the rolling's now done, or my child has crawled. Lovely, now we've crawled, now we can move on to the next step.
Exactly.
But what you're saying is it's more about getting that milestone to happen, but a quality out of that milestone.
That's exactly. And I think parents feel very much under pressure about what time my child does something, and the more pressure a parent feels, the more they want their child to do it earlier. And that's really what we don't want to happen. We don't want children to achieve milestones earlier than expected, and we don't want them to move on to the next milestone very early. So it's really not about, oh, my child achieved this milestone a month earlier. It's really about we wanting them to achieve it at the right time with the right quality, and for the right amount of time.
That's
so, for example,
such an important point, I think.
So for crawling, for example, it's not that they started crawling early and they only crawled for a certain period of time and then they started walking. It's really that they started crawling, they did a really good crawl for an extended period of time, and then only we want them to walk.
Okay. So beginning this whole travel, this whole journey
Yes.
of Milestones,
Yes.
we want to start, as I understand it, with head control. That
Exactly.
seems to be the place that everything begins. Lead us through, why is that head control so important?
So important. So really, a lot of parents will hear in the beginning, tummy time, tummy time, tummy time. And so it's not just about tummy time, it's that a child lying on their back is so much easier. It's easier to put your child on your back, but putting them on their tummy seems to be a little bit more difficult, a little bit harder for them. So it really is an equal between the amount of tummy time and the amount of back time, because we're wanting to work on both the flexor muscles as well as the extensors equally. When a child is on their tummy in tummy time, they're having to lift up their head and get neck control. And basically the real importance of that is, number one, to develop all the muscles down their back. Because if you think about it, once you're up and standing, there's no time to develop your back muscles. You're up, you're in an upright position, and everything happens in front of you. Very little happens behind you or against gravity. So when you're down and you've got to pull yourself up. So number one is all those extensors are really, really important. And number two is having good head control and good ability to move your head is really a foundational skill to spatial awareness. So there's a system called the vestibular system, and the vestibular system really is about development of muscle tone, and it's also about development of balance and knowing where we are in space. So as soon as a child has better head control, that the information that that system is receiving is starting to integrate. So therefore head control is a real foundational skill that we need for balance, for body awareness, and for knowing where we are in space.
So this vestibular system, really important in a child that's developing. What does that entail? It's an ear story, but what are the organs that are involved in vestibular system?
So basically the vestibular system, the organs and the receptors are within our ears. So it's within our inner ear, and basically there are 3 different canals. So the 3 different canals allow us to know movement backwards and forwards, movement side to side, movement upside down, and movement in a rotational sphere. And that basically is how I know where I am in my world, how I know where I'm moving, how I know which direction I'm going in. It's basically knowing where I sit in my world around me.
Okay, I get you. Now, I can understand that that'd be very important, even just to be able to lift your head up and know where you are, or to be able to reach out and grab something.
Absolutely.
Just to have that idea of where you are and where your environment is, and then how you can interact with that environment.
Absolutely.
Now, that lifting of tummy time, that lifting up of the head, which leads us into tummy time. Can you give me a sense of what makes good tummy time?
Yes, so tummy time should be something that's actually really enjoyable for children. So a lot of parents say to me, oh, but my child hates tummy time. And tummy time, if it's done at the right age, so quite early on, and if it's done in a really nice way, children really enjoy, or babies really enjoy tummy time. So it really is about, number one, putting something really fun in front of the child, even doing tummy time on the parent. So tummy time, your baby's lying on you and you're really interacting, lots of close face-to-face interactions. Tummy time, what we're looking at is a good alignment in that in the core. So basically, when a child is lying down, what we're wanting, even if it's on a mum or a dad's tummy, or if it's on the floor, we're looking for very good alignment and very upright neck control. So not next to the one side all the time, one to the other side, or we're not looking for a bit of flexion or the leg and the arm coming close together and this one quite far apart. We're wanting a child to be as straight up as possible with their neck going as straight up as possible.
Okay, so we're looking for symmetry.
That's exactly, yeah.
Okay. When do you start with tummy time? This is a question I get very often, because people, again, are very keen to not miss the boat when it comes to their children.
Yeah.
But they want to know, when do I start and how long am I doing it for?
So tummy time can start really from very, very early, from first few days, from first few weeks. Obviously starting off with the first advice I would give to parents is really starting with baby on your tummy. So baby on your tummy, you're getting them into that position and you're starting to encourage that interaction. At that point, the baby will only be able to lift up for a short period of time, if at all. And it'll start to increase over time. With tummy time, a baby just being on their tummy, I wouldn't let a child be there for an extended period of time if they're unhappy. So what we tend to do is we tend to go and go and go until they start getting a bit fussy and a bit irritable, and then we move the position. And that's with everything, whatever position a child's in. As soon as they're starting to get irritable, to get a bit fussy, then we know that there's something going on, that we need to change the position. So that we want it to be a real positive. I'm on my tummy, I enjoy this, I have fun. As soon as I say I've had enough now, then mum or dad pick me up and we do something else.
Babies are people too.
That's exactly, and they communicate. Yes.
Absolutely, and that's the important thing, is to be able to, it's part of the attachment, I suppose, as well, with babies, to be able to read each other and say, I'm not happy with this now, let's move on.
And there are going to be days, I think, with parents where one day they're going to be able to do lots of tummy time, and another day they're not going to be doing as much. And that's life, and that's normal, and that's okay.
That's a very important point, because I think maybe parents would get a bit worried to go, yesterday we did 10 seconds, we did 20 seconds, today 5 seconds and not happy. But just to know that there may be a host of other factors around why that's happening, and take maybe more of a longer term view of developmental milestones.
Absolutely.
Tummy time and head control are then going to lead to rolling, which is going to be our next thing. What is quality rolling?
So rolling, what we're looking at is obviously from a developmental perspective, the baby will be able to roll from their tummy onto their back a bit earlier. Okay. That's more of a log roll. They do it quite quickly, and sometimes it's a bit of a reflex movement.
And before mom's ready.
That's exactly, yes, yeah. And what we look at with rolling is we actually look at it the other way around. We look at from the back onto the tummy. Okay. And a real important thing to look at there is what happens is we've got an imaginary midline in the middle of our body. And with rolling, what happens is we start to cross that midline. And by crossing the midline, what it's showing us is that the two sides of our body are communicating together. And the more we can cross our midline and the more we can interact one side of the body to the other, that the two sides of the brain actually start to communicate. Okay. So with rolling, what we're wanting is that a baby uses their one arm, or it starts with the leg. And what happens is either the leg or the arm starts to cross the midline. And the other important thing that we look at is we start to get a bit of dissociated movements. So knowing that we're not just a log that moves, my hips and my shoulders are separate and they can move separately. So maybe my hips will go first and then my shoulders will follow, or maybe my shoulders might go first and then my hips will follow. So it's a real important skill for bilateral integration or midline crossing, as well as starting to separate the body parts a bit more. And that will then obviously be the foundations to the next developmental milestone.
Perfect. Let me say it this way. When do I start to get worried that rolling is not happening properly and that I need maybe a bit of intervention?
So I would suggest to parents that not to worry too soon, as long as the quality of the rolling is happening. So if it's more important that a child is moving their body in dissociated movements, so separate movements for a roll, than they're moving in a whole movement. So I would rather parents waited to know that we're moving the one part of the body and then the other part of the body, rather than two together. Okay, now we've achieved that, let's move on to our next developmental milestone. Rather waiting a little bit longer, so 6 months, 7 months, as long as the motion is happening with the quality.
Perfect. Because I think an important thing here is you can't really go back to that. There's a time where you're going to almost get the best that you can for your child out of that. So not to rush it. Yes,
because I mean, once a child's upright, they're never going to want to go back down again. You're going to have to constantly push them back down, and they're not going to do that. So it's really about when they are able to lie on their tummy or on their back for an extended period of time, we're wanting to really optimize that time.
I'm with you. Now, rolling is going to lead us to our next milestone, which is going to be sitting.
Yes.
Okay.
Yeah.
Now, sitting, what are we looking for in a good sit?
Okay, so what a child will do in the beginning is that they will sit with a wider base of support. Okay. Obviously, what parents do first is they give them a bit of support. And then what we're looking to do is taking away that support, but allowing the child to have a wider base of support. So base of support is how much of me is touching the floor.
Okay.
So what you'll see with a child in the beginning is that their legs are wider apart, and therefore they're able to balance a little bit more before they fall over. Once they've got that stability, what we're then looking at before we move on to our next milestone is that their base of support gets smaller and smaller, so that their legs get closer together. And then the next part of it is that they can move their bodies out of their base of support. So if I've got my legs quite close together and mum has a toy in front of me, I can reach there, get the toy, and then bring myself back instead of falling over completely.
Yeah.
And that is then a good sitting, where they can reach out, get something, come back and play with it. Reach forward, get something, come back and play with it, and to all different sides. And
Wonderful.
To all different
so
angles.
that's what we're
Obviously
looking
not
to get to with
That's
sitting, is to be able to be there, but then become functional in that position.
Yeah, with a smaller base of support.
Now the big one, crawling. That's where people really get involved, I think, because that's the iconic development is mobility. Going from being just static in one place now to being able to, it's almost like a big change of life to now I can move around inside my environment.
Yeah.
What are we looking for inside this crawl? Because there are a host of ways that babies will start to move themselves around. They're little hack masters. And if they find that this works, I'll do this or that.
That's exactly.
What are we looking for?
So what we're looking for is we're looking for a obviously a downward crawl. So a lot of children will do what we call a bum shuffle.
Okay.
And a bum shuffle is not a crawl. So from sitting, children tend to then put their legs out and they just shuffle their bums around. What we're wanting is we're really wanting a position from a 4-point kneeling, or going from tummy time into a 4-point kneeling position. What we want is a symmetrical alignment. So if the foundational developmental milestones have been achieved, what we should see is that a child has strong back muscles and they've got strong stomach muscles. If they have got really strong back muscles, they might not be able to bring their legs in. And if they've got really strong tummy muscles, they might not be able to lift up their backs to start the crawling motion. So it's really important before they start crawling that they've got strong tummy muscles and strong back muscles.
So this is why we don't rush the initial ones.
That's exactly.
Because that's giving us the ability to move to the next
Exactly. When they're crawling, obviously we want alignment, very good alignment. And the really important thing about crawling is that the arms and the legs are moving opposite. So when this arm moves, this leg will move, and when this leg moves, this arm will move. And that's what we call bilateral integration. That's really important to know that my one arm can do something different to this arm, and my one leg can do something different to my other leg. That's really important for knowing my body awareness, what my body is doing. And then if you look much later on, it looks at things like hand dominance. So crawling and hand dominance is also something really important. Crawling and reading. So reading from one side to the other side of the page, crossing the midline again.
I'm with you.
Okay.
So when does a parent go, maybe this crawl is not working as well as I would like it to? What are our red flags?
So a big red flag would be if a child's not crawling. A crawling amount of time that is a very good amount of time should be about 3 months.
Okay.
Anything less than that's not optimal. I know children want to be upright as much as possible, and obviously parents try and lift
We want to get them upright.
Yes, they want to lift their babies up. It's so much fun. Once they're upright, they don't want to go back down again. So we're wanting them to crawl for quite an extended period of time in a good crawl, so a good symmetrical crawl. Once they get to about 11 months and starting to go close to the age that they should be walking, and they haven't got a very good crawl, that's when we need to start to intervene. Obviously, if we can intervene earlier, so about 9 months, a parent should be really involved in getting the crawl right. If it's not working, obviously early intervention is key. So if it is having one occupational therapy session to say, what do I need to do? And then the crawl happens, and then they crawl for 3 months, that would be optimal, rather than leaving it too late, and then we can only do a crawl for a month or 2 months.
Small intervention at the best time, giving us the best outcome.
That's exactly.
Fantastic. So crawling then
Yes.
leads to walking,
Yes.
which is what they're going to be doing literally for the rest of their lives. So we
Exactly.
want to get that good right in the beginning.
Yes.
What are we looking for that movement to walking? I get a lot of parents that talk about cruising, where
Yes.
that's the first thing that child does, that they hold on to something, hopefully it's stable, and they lift themselves up and they start to cruise,
That's
and then they move into the walk.
That's
what are we
exactly.
looking for in a
So,
good walk?
with walking, what a child will do is obviously they're needing support first. They will tend to have a wider base of support again, so their legs are wider apart, and then that will allow them a bit of movement. What we're looking at is for them to move away from that wide base of support as much as possible. So they initially will have a wide base of support and they'll need an external support. And once they're safe without the external support, they will start to move with a wide base of support. We're needing them then to start to bring their legs a bit closer together.
Okay.
So if a child has a very wide base of support for a long period of time, that's a bit of a red flag. We need to look at why are they still feeling so insecure in their walk. And if their legs get closer together, that's really good, and then they can start that bilateral leg movement.
Very much the same idea as the sitting, where it's the base
Yes.
of support that we want to bring smaller and smaller.
That's
and
exactly.
the more control they gain, the less
Yes.
wide base of support they
That's
gain.
exactly.
Require.
Yeah,
Okay,
and the
perfect.
same with walking. As soon as their base of support is a bit smaller, they will be able to move out of that and come back in safely.
Okay, perfect. So Jennifer, thank you so much for sitting down with us today and opening up this amazing world of development within infants. If I could just ask you, where does occupational therapy sit
Yes.
in the whole sort of spectrum of development? When would you, as an occupational therapist, love to get involved with a child?
So occupational therapy it's a bit of a conundrum of where we sit within all the professionals, or the medical professionals. So occupational therapists really look at function. And so motor skills development is all about giving child the ability to function, to develop. Obviously from our side, early intervention is key. So if a parent is starting to identify particularly motor developmental delays, or a child not achieving their milestones as they should, just a once-off assessment by the OT to say, this is what's going on and this is what you can do to improve it, and I will see you in a few months' time or a few weeks' time or whatever is necessary, will be what then speeds up that process, or make sure that that process is as accurate as possible.
Yeah.
So I would really recommend parents don't shy away or leave things, and rather are a bit more proactive, and they say, what can we do? Let's have a once-off consult, let's see what we can do, and let's just check that everything's going okay.
I think that makes a lot of sense, because possibly the idea would be, I'm going to get involved in occupational therapy ongoing, but what we're saying is, get it checked out first.
Yes.
Just make sure that everything is perfect, and if it is, off you go, and everything will be fine.
Exactly, and also preventing having to do more intervention at a later point is also what we want. Is we don't want children to be in therapies for extended period of time. We want children to be developing as they should be at a very young age, so that to then avoid any additional therapies that they might need.
Wonderful, perfect. Thank you so much.
You're welcome. Thank you for having me.
If you enjoyed this episode, hit the subscribe button below. And remember to check out our pre- and postnatal education courses at easybaby.co.za. You got this.